Today we're going to talk about teen suicide and its effects. Why am I bringing up this topic today? Because we were asked by one of our listeners because he felt it was very relevant to family members that are dealing with this issue. Complex issue, a lot of things to bring up, a lot of things to talk about. This is not going to be, this is going to be more than just a one-parter. However, we're going to do what we can to get it started. We're going to go from there. And I want to give people a sense of understanding of what suicide does to teens, some of the warning signs, how it affects people around them, and everything that goes along with it. Here we go. All right. First of all, let me clarify something. Suicide is found everywhere around the world. Okay, number one. So, and it's in every culture, every ethnicity. It doesn't discriminate, so to speak. And there are a lot of issues regarding social issues, cultural, religious, socioeconomic, in addition to mental health disorders. Okay, now, first I want to start off with, what are some myths and facts about suicidal behavior so you understand this coming from a clinical perspective? Number one, someone who's really smart and successful never want to kill themselves. Boom. Reality check. No. People often keep their plans secret. Suicide, again, knows no cultural, ethnic, racial, educational, income boundaries. Because you seem like you're on top of the world, big deal. Plenty of people who have committed suicide. Okay, number two, people who commit suicide are often looking for attention. No. A suicidal event is often a critical incident that will often lead the deeply distressed person to first actually seeking contact with a mental health professional, such as myself. Okay, people who attempt suicide are crying out for help. It's not like, wow, I wouldn't want people to see me, covered in blood, laying in the ground, poison coming out of my mouth, looking horrible, looking horrific, mangled. No. It's a cry for help. Okay. Suicide, another myth. Suicide is a natural response to not being able to deal with stress. Myth, reality. Suicide is an abnormal outcome of stress. We all have stress. We all have stressors. Just getting here to do the video was stressful today. And you know what? We all deal with it, but people who try to commit suicide are not the vast majority of people that deal with stress on a daily basis. Clarify that. Myth. Once a person attempts suicide, they will continue to do it again and again and again until it actually happens. Reality. The intensity of suicide, what they call waxes and wanes, goes ups and downs, and many people who attempt it struggle with their convictions about wanting to kill themselves and dying. Okay, myth. When a person, decides to take their own life, there is nothing anyone can do to stop them. Reality, that is not true, okay? People who often have suicidal issues are often dealing with major depression on some level. So that's often a cry to get them help, either with counseling, medication, lifestyle changes. So don't say that there's nothing anyone can do. Yes, there's always something you can do. Okay, now, another myth, antidepressants, which we've talked about a lot here on these different videos, such as SSRIs, that's a common term for them, increase the risk for suicide among adolescents. Reality, contrary to a lot of public opinion, treatment with depression who take it does not increase, but rather decreases suicidal rates. Because you're taking medication to help you control your depressive thoughts, i.e. leading to suicidality. So it actually helps to lower suicidal rates. All right, another myth. Talking to someone who is suicidal will make their suicidal symptoms worse. Not true. As a clinical social worker, I have assessed thousands of people, and I talked about before, probably I had several hundred people tell me they were feeling suicidal. And you know what? I'm probably lowballing it, probably higher than that. Probably, I've done, 10,000 people, probably about 2,000 have said to me, hey, it was current, it was recent, it happened a while ago, it happened several years ago, it happened a decade ago, I was in my 50s, I did it in my 20s. Trust me, people who talk about it, it will not make their suicidal symptoms worse. It's an avenue to help me explore where the person's head was at that time, and what they were dealing with, and why they felt so hopeless and helpless. The only option that they saw was suicidal behavior. So it will not. And often, if you're actually showing concern about somebody, that might give them the impetus to actually go to get some help. And I got this information from Team Mental Health regarding their suicidal thinking. Now, a couple other issues I want to bring up while we're talking. Suicide itself is not a mental disorder. Okay, this also still comes from team mental health. But one of the most important causes of suicide is not a shock, mental illness. Okay, what are the biggies? Depression, bipolar disorder called manic depression, schizophrenia, and substance use disorders. It makes sense. If you're taking pills because you're not happy, boom, you're suicidal. If you're hearing and seeing things, that's a terrible disorder, schizophrenia, you're often going to feel suicidal. Okay, if you're depressed or bipolar, that leads again to suicidal options. I feel worthless. I feel like a loser. I feel like a nobody. Boom, 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 boom. So people who are depressed, bipolar, schizophrenia, substance abuse, these are the leading categories that push someone, so to speak, over the edge to try and commit suicide and obviously kill themselves. Okay, let me clarify something about suicide. They state that for every suicidal individual that actually commits suicide, they call it 6 survivors are left behind. That, in other words, every time someone kills themselves, unfortunately, 6 people are affected, then they're called survivors. And it could be siblings, family members, loved ones, best friends. Let me clarify something for myself. Even though, again, clinical social worker, I've had about half a dozen people commit suicide that I've known, probably 6 to 8. And each one of them ripped me up. I was close to some people, very close to some of them, and I didn't know. The great genius, Bruce Muffson, LCSW to the stars, he didn't know. How did I not know? How did I not see the signs? How did I not see the warning signs? It ripped me up. I understand the terms of the survivors. I feel like a survivor when I think about those people that kill themselves and why. And I wish I had a chance to say to them, don't do it, don't do it, don't do it, don't do it, and give them some hope for the future, and I couldn't do it. I understand what that means about survivor's guilt. Not just about suicidal stuff, but you understand what that means when you're a survivor and you bear the brunt of their pain, and you couldn't take that pain away, make them feel better about themselves. All right, now, what are risk factors you gotta be aware of? Again, still going from team mental health. Number 1, the presence of a current suicidal plan. And how do you often find this out? Well, you ask. You ask the question. Are you suicidal? Yeah, I got a gun in my house. Yeah, I want to take my car and drive it off a bridge. Yeah, I'm going to take an overdose of medication. Yeah, I'm going to cut my wrist in the bathtub. So that's what's called a suicidal plan. Number 1. Number 2, previous suicide attempt. Often in mental health, what you do prior is what you're going to do now and later. Is there a previous suicide attempt? Very likely you're going to do it again. You get the confidence. Many suicide attempts, the vast majority, by the way, are not successful the first time. Why? The person has to get confidence. And I've had people as young as 6 and as old as 80 tell me, I tried it, I'm going to try it again. They're getting confidence. They're getting, I know how to handle myself when I feel the gas coming into the car, where I felt the knife cut my wrist, where I felt the noose around my neck. It was scary, not so scary. I'm going to do it again. Okay, history of mental health disorders, like we talked about before. Okay, do they have availability? Is there a gun in the house? If you're a parent and you have a child, don't leave firearms in the house, even locked up. Kids are incredibly creative. They'll pick the lock, they'll pick the gun case. So no weapons in the house, at least certainly not guns. Knives, unfortunately, you got to be careful. You look at your kitchen. But is there lethal availability in the home? Guns, 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 guns. Okay, many people who attempt suicide were actually carried out are using firearms to do it. Is our old friend here, history of child sexual, physical assault or abuse. Well, you hate yourself, you hate who you turned out to be, you're 25 years old, no relationship, no connection, you feel like a loser because you were molested. Unfortunately, that's very, very likely that you're going to hurt yourself, unfortunately. Family history and family history of psychiatric illness. So you're looking for is, what are you looking for? You're looking for a background. When you're a clinician, these are the kind of questions you ask during an assessment, but I want you, the viewer, to realize you can do this yourself. The reason why we're doing these videos, what is the purpose of these videos, is to give people the confidence out there that they can ask questions and start making some answers and making some inferences. And then, God forbid, you need to go somewhere deeper, you find me, you ask me. But these videos, one after the other, are for you people out there to start realizing, to get the confidence. You can figure these things out for yourself. You don't have to sit back and wait. And sometimes you go to therapists, they don't give you the right answers. They don't give you the truths. Here, I'm giving you all the availability now so you can have it. If God forbid you're in that kind of situation, you know what to ask, you know what to look for, you know where to go with it. And if you need further help, that's a 911 call, to get the help that you need. But get started. Take control. Don't be afraid. Don't feel like, I can't ask these questions. Yes, you can ask these questions. And if you do, God willing, you might save a life of someone that you love, that you care about. And trust me, going to a funeral for someone who committed suicide is a dreadful, dreadful, dreadful moment. It's terrible. I've been to funerals where they couldn't even show the body because it was so mangled. So they have an urn where they have a casket. And it's, you're looking at your friend, your buddy, your coworker, and that's what they turned out. It rips you up because it ripped me up. So I'm telling you, you can have the confidence to do these kinds of things. Now, here's a couple of questions you can start asking people if you're nervous about it, where it's going to come from. Ask what's called ideation. Have you been thinking? Ideation, idea, that's where it comes from. About dying, harming yourself, or suicide. It's called ideation. Have you been thinking about it? Ask about intent. Have you decided you're better off dead than alive? I've had that happen to me hundreds of times in assessments. Are you better off dead than alive? People say, yeah. I weighed the odds. I looked at, you do this on the fly, see, very quick. And you go like this. I've had people do this to me. Live, die, and they have this, and they'll come like this, and they'll say, I got more dead than alive, so you know what? I might as well kill myself. Boom. That's what they'll say to me, just openly, very blunt about it. Living or dying. Better off dead. Let me kill myself. That's my intent. And finally, plans. What plans have you made to kill yourself? Again, I got the gun, I got the poison, I got the car, I got the gas. I'm going to have the gas come into the garage, and I'm going to kill myself. Now, so again, I want to clarify those three things again. Suicidal ideation, suicidal intent, suicidal plan. Suicide ideation is ideation about death or dying, wishing they were there. Not usually persistent, but they're fairly common in people with mental disorders, with those that are having a tough time getting through life. Suicidal intent, the idea is now forming. Intent, how am I going to do it? Think about committing suicide most of the time. And what would life be if he wasn't there preparing? And then suicidal plan is that my wife's out of town, my kids will be at school, I have a long weekend, it's going to be Thanksgiving, no one's going to be checking up on me for a couple of days, I live alone. This is the time I want to kill myself. Okay, now, here we go real quick. This came out from helpguide.org, and this is about helping people, Parents' Guide to Teen Depression. Learn the signs of depression in teens and how you can help. Okay, that is one of the biggest issues when I do assessments, I do work with teenagers, is how depressed so many kids today are. A lot of kids are very, very, very depressed. More than ever, in my opinion, since I started this about 20 years ago. Kids are dealing with depression. Now, it strikes kids far more often than people think. And unfortunately, here's the problem. Teens don't get help. They keep this to themselves. They feel lousy. They feel like losers. They feel like jerks. Rather than tell parents, teachers, people that they have most in common with, church people, people that are ministers, youth ministers, coaches, keep it to themselves. Keep it to themselves. What is the result? Suicidal thinking. Don't. The biggest thing I want to share today, more than anything else, is this. I'm going to use 2 lines. Communicate. Okay? Communicate. Talk to your kids. Communicate. Not spelled all that great. Communicate with your kids and how they're feeling. Let them know you're there for them. So often when I do assessment, I do clinical work, I always say to the kids, well, did you talk to your parents? You talk to your family? No. You're the first person I'm telling this to. Why? Doesn't make any sense. Talk to your family. Get it off your chest. Let people know how you're feeling. If not your parents, a best friend, a buddy, someone at school, someone at church, someone you relate to, a mentor. Don't keep it hidden. Communicate. I know I feel so embarrassed that I wrote that word, so let me do it one more time. I don't want to embarrass the people out there. communicate. Okay, there you go. Okay, now, here's a couple of things I want to clarify also. So really, the problem is when more adults will go get help, only 1 in 5 teenagers, 20%, will go and get help. And also, here's another reason why. Parents usually will have health insurance or they can go to a doctor. For teens, you have to first go to an adult, and that's very, very scary because that admits you have a problem. And they're often afraid to go make that jump. So if you have an adolescent in your life, and we all do, be aware of it. Okay, we're going to get back, and we'll be doing our second part of this, but we'll be discussing some of the signs to look at with teens and what to be aware of. Thank you.